Welcome to the 9 on this Tuesday.
Well, as we've been talking about all morning long, those mask mandates are back in 7 Bay Area counties. This as coronavirus cases surge even in highly vaccinated areas. And the start of the school year across the Bay Area is fast approaching. So let's bring in Dr. Karin Shavelson, who's the Chief Medical Officer for MarinHealth. Good morning to you.
Good morning. Thank you.
So there is so much to talk about with the mask mandates, the start of school. And when we talk, I've heard this from so many different public health officials. Messaging is important. It keeps changing, but it is important. So what is your message this morning?
My message this morning is, unfortunately, we've gone a bit backwards. It is time to go back to wearing masks indoors, to be very careful with social distancing and hand washing. We're not only seeing COVID and obviously the Delta variant, but we're seeing other viruses like influenza, RSV, rhinovirus. So if you don't feel well, if you have a cough, if you have a fever, please stay home, talk to your healthcare provider, and seek testing. If you're unvaccinated, it's imperative that you don't mix in crowds. It's imperative that you share your status with others who may be around you and therefore at risk of contracting COVID. I would highly recommend, if you're unvaccinated, now is the time to get your vaccine. It takes time for that immunity to build up, and Delta variant is like a heat-seeking missile. It's going to find you, unfortunately. So please get vaccinated.
So every time we have gone into a mandate, or last year we went into lockdown, everyone asked the same question: how long? How long until we see, okay, things may get better again? Because we are seeing vaccination rates going up across the country, but as you just mentioned, it takes a while, especially if you're getting the first shot. Then you wait a few weeks for the second shot. You have a highly vaccinated community in Marin. We have highly vaccinated communities across the Bay Area. The numbers are good, but we still couldn't avoid this.
Yeah, we opened up and we all started traveling and we started getting together again, and that allowed Delta variant to find a way in, unfortunately. Currently, the models are showing that the peak from Delta variant will be sometime in October. Obviously, we're hoping that that trend can be reversed through vaccination and other measures. But right now, it looks like we're in this for another couple of months, and then our fear as healthcare professionals is that this will run into the usual late fall, early winter virus season, which is influenza, RSV, and those sorts of viruses. We didn't see much of that last year because we were all home and masked and socially distancing, but we can expect to see a bit of that this year too. So we're really hoping that people will take this as the time to get vaccinated so that we can go into winter with a little bit of reserve and hopefully not be contending with a big COVID surge.
Well, the idea was that we'd have better habits, but I guess the question is, how much further are we going to get? I mean, we've been in stories this morning here on Mornings on 2 about the companies requiring vaccinations. And is this what we're going to now? I mean, we went from recommending masking indoors to requiring it, and everything seems to be leveling up. How much further are we thinking we're going to have to level up to really stop what you're seeing in terms of trends?
I think the only true weapon against the virus is going to be vaccination. And so it is imperative that people are vaccinated because we're open in the sense that I can travel from California to Texas or Florida and encounter the virus. It's imperative that not just in the Bay Area or in Marin, but in the rest of the country that we see improved vaccination rates. Of course, this is a global pandemic, and so we should also be very mindful of countries throughout the world who don't have the same access to vaccines that we have here in the United States. But really, the one true weapon against this Delta variant, against COVID, against any future variants is going to be vaccination.
So a business comes to you and says, should I just mandate this? A business owner is saying, should I just require it? Your advice to them is?
Yes, please.
And so if we go then now to schools, because you're also a pediatrician, when it comes to students in schools, you talk about the health. The conversation isn't just about COVID. It's about mental health. Children struggled last year, but you got vaccines only available right now for 12 and older. So teachers are vaccinated, but the children, even if they don't get seriously ill, can spread it. It's complicated. What are you saying to parents in this situation when it comes to balancing really all of those concerns, because they're all so important?
Yeah, absolutely. Well, if those of us who are eligible to be vaccinated, so 12 years and older, if we would all be vaccinated, that would go a long way to protecting our pediatric population. As your story reported earlier, parts of the country are seeing surges in pediatric COVID cases who are quite ill, which is really sad and unfortunate. And so if one needs a reason to be vaccinated other than protecting one's own health, please do it for the children. Please do it so they can go back to school in person and be safe. Masking will help, social distancing will help, hand washing will help. But really, us adults, those of us 12 and over, we need to be vaccinated. That will definitely help the pediatric population. And then we're optimistic that the vaccine will be extended below the age of 12, hopefully in the coming months.
Yeah, we talked about maybe September, and then you think maybe October. I mean, that's when they said they'd reevaluate maybe the masks in schools as well, though that was before all of us were required to mask up again. Do you think that really will dramatically change the picture when 11 and under can get vaccinated and it's even more of the population?
Absolutely. I think it would be tremendous when we start to vaccinate the pediatric population. I really look forward to it.
Okay. All right. Well, a lot to talk about, a lot to continue to discuss as we hope that masking up puts us back in the right direction. Dr. Karin Shavelson, thank you so much for joining us and for your insight. We appreciate it.
Thank you. My pleasure.
A lot of parents waiting for that day. Their 11-year-old and younger children can get vaccinated.
I know. My friend's son just turned 12. That was his birthday present.
Oh, wow. Interesting.
It really feels like it'll change the ball game once that large group can get vaccinated. In the meantime, like the doctor said, vaccinating the adults is the best way to protect the kids.
Right.
From KTVU Fox 2 News, this is The Four.
Well, the spread of the Delta variant causing a lot of concern with case numbers spiking around California and the Bay Area. Joining us now to talk about this is Dr. Karin Shavelson, the Chief Medical Officer for MarinHealth. Dr. Shavelson, good to have you on. Appreciate it. It sounds like part of the rationale for these indoor mask orders is the relatively uncommon breakthrough cases among fully vaccinated people. How much of a difference do you think these indoor mask orders can make in terms of reducing the overall spread of the Delta variant?
I think we're not entirely certain, but I think we feel quite strongly it's of sufficient benefit to both the vaccinated and the unvaccinated, that it's really important. I think everyone should remember that there's an entire population that we can't vaccinate, and that's children ages 11 and under. So we really need to protect those vulnerable patients that can't be vaccinated yet. And this is one way we can all do that.
What do you say to the folks out there who are vaccinated who say, look, I've done my part. Why do I need to still wear a mask when I'm indoors?
Well, we're all in this together, and unfortunately, because of these breakthrough cases, people who've been vaccinated, myself included, we need to be part of the bigger picture. We need to contribute to our overall community. Again, let's keep children safe. Let's keep the frail safe. We know that the breakthrough cases are rare, but the people who are most likely to be affected are those who are older or have other medical conditions. And breakthrough cases can happen, and they can be serious. It's incredibly rare, but it can happen. We need to be mindful not just of our own frustrations with masking. Nobody is sicker of masking than healthcare workers, I promise you. But it's something that we all need to do to keep one another safe while we're in this Delta spike.
Obviously, you're on the front lines trying to get more people vaccinated. When we re-implement mask mandates like this, in part because of breakthrough cases among folks who are vaccinated, does it make your job more difficult as you're trying to convince someone who's unvaccinated to go ahead and get the shot?
I think it's frustrating when people who are eligible for the vaccine only think of themselves. The Delta variant, it doesn't know political boundaries or religion or your views or your politics or your feelings or your fears. It only knows your body, and it's going to come infect you if you haven't been vaccinated. And again, children ages 11 and under, they can't be vaccinated. So this Delta variant, it's like a heat-seeking missile. It will come for you. It will find you if you haven't been vaccinated. We're very fortunate in the Bay Area that we have such high vaccination rates. But in other parts of the country, Texas, Florida, where we're seeing huge number of cases, it's crept its way into the pediatric population. And we're seeing devastated COVID infections in pediatric patients, which we really hope to not see here in the Bay Area. So please wear your mask, get vaccinated.
To that end, in terms of trying to get more people vaccinated and sort of compelling people to get the shot, I know at MarinHealth, all the employees and physicians are required to show proof of vaccination moving forward. A lot of other healthcare providers, Kaiser among them, doing the same thing. Lots of large companies, cities and states also requiring vaccinations for employees. Do you think that this sort of tougher approach will work to ultimately raise the vaccination rates?
Absolutely. I definitely hope so. And I think it's imperative that in healthcare settings, our patients feel safe being cared for by clinicians and staff who are fully vaccinated and practicing safe policies around infection prevention. I think seeing other companies like Walmart and Amazon and others join in this cause is really incredible and inspiring to those of us who've been on the front line. I'd also like to applaud the small business owners that take the really tough step in terms of adopting some of these practices. We're all very sensitive to how the pandemic has been particularly challenging for small business owners. So those of us on the front line who are battling this, who are seeing people dying still, who are seeing rising numbers of hospitalizations in unvaccinated patients, we thank you. We thank all of you for joining us in this.
Finally here, Doctor, how does this current Delta surge that we're seeing right now compare to the previous surges we've seen here in the Bay Area? And how long do you think it is before we get out onto the other side of this one?
It's a little tricky, no crystal ball here. The numbers are worrisome. The trajectory is worrisome, but we have to remember that the bulk of disease right now, the bulk of the worrisome disease is in unvaccinated patients. The Bay Area overall did really well with vaccination, Marin County in particular. But we know that now that everybody is out enjoying themselves and traveling and mingling, that we're seeing this rise in Delta. The models right now are forecasting a peak in October. We hope that's the case, but you can do your part. If you are eligible to be vaccinated, please go get vaccinated. It is the one weapon that we in healthcare have against this virus. Don't wait until it's too late. These stories of people dying in ICUs, suffering in ICUs, talking about their regret for not being vaccinated, it's unnecessary suffering. It's unnecessary death. Please get vaccinated.
Yeah, we are seeing far too many of those stories as of late. I appreciate you taking the time, Dr. Karin Shavelson, Chief Medical Officer for MarinHealth. Appreciate it.
Thank you.